JoAnn E. Manson. She originally got her start in service by seeing her mother, who was a medical social worker, work and care for people. This led her down a path of service, and her high school chemistry teacher helped push her towards the sciences. This teacher advocated for more women pursuing a career in medicine, which was not very common in that time. She went on to obtain her undergraduate degree at Harvard, her MD at Case Western, and her master's and doctorate in public health also at Harvard. Before getting her public health degrees, she completed her residency in endocrinology in Boston. Early in her medical career, her mother passed away due to ovarian cancer. This led her to become more interested in preventative medicine and women's health because she was able to see the gaps in knowledge from her mother's battle with cancer. This is when she found her main focus and became more interested in the research that she currently works on. Some of her hobbies outside of her job and research includes playing the harp, painting, creating sculptures, and hiking. In college, she was also the dance and theater reviewer for the Harvard Independent. She's also married and has 3 kids. The reason I admire her is because after her mother died, she was able to see where she could make a difference and decided to do something about it, and dedicated her studies to preventative and women's health. I identify with her because she's a woman in medicine, and that is what I would like to go into. She was also the first woman to become a chief of preventative medicine at Brigham and Women's Hospital. Her main field of study is medicine, mainly on women's health and getting more research on preventative care, and seeing how women are affected differently than men in things like drugs and diseases. She does not have many specific questions, but she mainly studies preventative techniques like nutritional and lifestyle factors in women for things like heart disease, type 2 diabetes, and cancer. Her most recent paper was published on October 10th, 2023, and it's titled Cocoa Extract Supplementation and Risk of Type 2 Diabetes, the Cocoa Supplement and Multivitamin Outcomes Trial, also known as COSMOS. This trial showed that there was no significant difference in risk for developing type 2 diabetes when taking a cocoa extract supplement. This method used in the study was a randomized clinical trial that went on from 2015 to 2020, which included 4 groups. One that would take 500 milligrams of cocoa extract and a multivitamin, one that would take cocoa extract and a placebo multivitamin, one that had a cocoa placebo and a multivitamin, and one that would take 2 placebos. They tested this on about 20,000 people who had previously not had type 2 diabetes, and they had asked these people to fill out a survey each year whether they had been diagnosed with type 2 diabetes in the past year, and if they had, to give the month and year it was. After compiling this data, they came to the conclusion that there was not a significant difference between any of the groups in the number of type 2 diabetes diagnoses there were. This shows that cocoa extract does not reduce the likelihood of developing type 2 diabetes. And I've included the figure right there that shows the graph in the placebo versus the cocoa extract. Her main work has been with the Women's Health Initiative, which focuses on hormone replacement therapy for postmenopausal women to deal with their symptoms. She helped discover that there was an increased risk of breast cancer, heart disease, and stroke, which led to the re-evaluation of HRT's use. She also has done a lot of research on how living a healthy lifestyle can prevent chronic diseases like type 2 diabetes, heart disease, and cancer. She's been a part of many groups and large trials, such as the Nurses' Health Study, Vitamin D and Omega-3 trial, the Cocoa Supplement and Multivitamin Outcomes Study, as I just went over, and the Vitamin D for COVID-19 trial. Her next steps are to continue her work in type 2 diabetes prevention, and her hope is to find a cure in the next decade, and also in identifying powerful prevention tools. And then here are the references that I used today.